Hi, welcome again to InjuryGuru.com. I'm Carla Schimmelfinnig, registered physical therapist, and this is exercise number 3, video number 3 in the knee arthroscopic surgery exercise program number 2. That is a mouthful. So for this exercise, this is one of my favorite exercises. This is an exercise that I'll get my knee patients who've had this surgery doing as soon as I can. So you can do this at home easily. You need some books. So if you have a large stack of books like this, or anything else you can think of. This is about 3 inches. So anywhere between 3 and 5 inches. 5 inches is on the high side. So to start with, you may want to make sure that it's closer to 3 inches. And this exercise is called a lateral step down or a lateral step up. It's actually most of the time called a step up in our field, but it's never made much sense to me. You're stepping down. Or you're moving downward. So I call this a lateral step down. I want you to have a chair next to you. So just bring, wherever you're doing this, grab a kitchen chair, bring that with you. If you're unsure or just not sure that your books will stay still, then just push these books right up next to a kitchen counter. That works great. So the base of your cabinets at your kitchen counter, and then you have your kitchen counter to hold on to too. You can also place a chair next to you on your other side, so you have plenty there for support and stability in case you're a little nervous or your balance isn't the best with this exercise. So let me show you the lateral step down exercise. So for this one, you're going to put your foot, so that operated leg, that foot goes up on the books or whatever you have found that's about 3-4 inches high. And then I want you to put all your weight on this leg. Your good leg, your good foot should just be hanging here in space, not touching the ground. You can hold on to that chair, like I said, if you have pushed your books up against a kitchen counter or the base of your cabinets, and you can hold on to the counter also. But this exercise, the most important part of this one, is what I'm about to tell you. So what you're going to do is bend and straighten that operated knee just to where your good foot, the toes of your good foot, just barely are lowered down to touch the ground, and then you come back up again, or you straighten that operated leg. So I'm bending my operated leg till my toes just touch the ground and then come back up. The most common mistake that people make with this exercise is they actually step down like this, right? So it's not actually stepping down. It is keeping all your weight on that operated leg while you bend and straighten that leg. And you're going to bend it till the toes on your good foot touch the ground, and then just come right back up. All right, so that's just for a little bit of balance. Also guide you so you know how far you're going to bend that operated leg. So you can see all my weight is staying on this leg. It's not stepping down like that. It's staying up here and just bending and straightening. All my weight stays toward that operated leg. So that is it for that lateral step down, or a side step down, step up, whatever you want to call it. But that's what it should look like. All right, for this exercise, I want you to do 3 sets of anywhere from 10 to 15 repetitions. When you first start, you can start with 10. But if it's not too tiring and you can handle it, I want you to move on to 3 sets of 15 repetitions. When you do this, you're going to feel a lot of fatigue right here in the front of that thigh or that quadricep muscle. And that's where you want to feel it. If you're feeling it there, then you're doing it right. Make sure that you continue with some ice if you still need it on that knee. If it's irritable, swelling, even if those incision sites are still a little red, put some ice on that knee. It's going to make it feel better. Continue to use the bike if you started off using the bike, and if you have one at home to use, make sure you're still using the bike. That one's great for getting your motion back and for strengthening up that leg.